Hey everybody, welcome to another lecture from CyberMD. Today's topic is Wolff-Parkinson-White Syndrome, or WPW, a congenital heart condition that affects the electrical system of the heart. This is an important condition to be familiar with as you prepare for the USMLE STEP 1 exam and would be very important for you to notice in clinical practice as well. Please be sure to like, comment, and subscribe so that we can continue to provide free medical education resources to students around the globe. WPW is caused by the presence of an accessory pathway, also known as an accessory conduction pathway, in the heart. This pathway is an abnormal electrical connection between the atria and the ventricles that allows electrical impulses to bypass the normal conduction pathway through the atrioventricular node. This can result in the rapid heart rates known as tachyarrhythmias. The exact cause of the formation of this pathway is unknown, but is thought to be related to genetic factors or issues during embryogenesis. WPW occurs in less than 1% of the general population and is more commonly seen in males than females. Peak prevalence is between the ages of 20 and 24, but some patients may go undiagnosed until much later in life, affecting these numbers. In Wolff-Parkinson-White Syndrome, the presence of that accessory conduction pathway again allows electrical impulses to bypass the normal conduction pathway through the AV node and travel directly from the atria to the ventricles. This can result in rapid heart rates, including supraventricular tachycardia and ventricular fibrillation. Supraventricular tachycardia is a rapid heart rate that originates above the ventricles, while ventricular fibrillation is a rapid and irregular heart rate that originates in the ventricles. Both of these tachyarrhythmias may lead to sudden cardiac death. Patients with WPW syndrome may present with symptoms such as palpitations, chest pain, shortness of breath, and lightheadedness. These symptoms may be triggered by physical activity, stress, or other factors. A thorough physical exam is important to rule out other causes of these symptoms, such as heart disease or lung disease. It is also important to note that some patients with WPW may be asymptomatic and only discover that they have the condition during routine medical testing or testing for other issues. The diagnosis of WPW is usually made based on the patient's symptoms, physical exam, and EKG. EKG findings are the key diagnostic feature of WPW, as it will show a characteristic delta wave and a shortened PR interval. The delta wave is a specific pattern seen on the EKG that represents the electrical impulses traveling through the accessory conduction pathway. It is classically described as an upward slurring at the start of the QRS complex. The PR interval represents the time between the electrical impulses in the atria and the ventricles and is shorter in Wolff-Parkinson-White because the electrical impulses are traveling directly from the atria to the ventricles, bypassing the AV node. So to recap, on an EKG of a patient with WPW, you would see a shortened PR interval due to the bypassing of the AV node as well as an upward slurring or delta wave at the start of the QRS. The treatment of Wolff-Parkinson-White typically involves cardiac ablation or medications to slow the heart rate and prevent tachyarrhythmias. These medications most often include drugs such as flecainide. It is important to differentiate Wolff-Parkinson-White from other conditions that can cause tachyarrhythmias, such as atrial fibrillation, atrial flutter, and ventricular tachycardia. The EKG findings, symptoms, and physical exam will help differentiate WPW from these other conditions. The prognosis of WPW is generally good with proper treatment and management. However, if left untreated, it can lead to serious complications, including cardiac arrest and sudden death. Regular monitoring and treatment are important to prevent these complications. Untreated Wolff-Parkinson-White syndrome can lead to serious complications, again including cardiac arrest and sudden death. In addition, tachyarrhythmias can lead to heart failure, stroke, and other serious health problems. Regular monitoring and treatment are important to prevent these complications. In conclusion, Wolff-Parkinson-White syndrome is a congenital heart condition that affects the electrical system of the heart. It is important to be familiar with the etiology, epidemiology, pathophysiology, H&P, evaluation, EKG, treatment management, differential diagnosis, prognosis, and complications of this serious condition as you prepare for the USMLE Step 1 exam as well as clinical practice. Please be sure to like, comment, and subscribe so that we can continue to provide free medical education resources to students around the globe. Thank you.